And a minute to get everybody in, and looks like we're recording, so we can get started here. Again, happy Friday, welcome. Weather's not that great, but we had a fairly nice week after the weather report had said it was going to be raining all week. I was pleasantly surprised to see the sun most days, so I guess we got to take some rain a little bit in the spring, right? So I do have a few general updates that I'd like to get to before we go to the Q&A, but as always, find the Q&A icon on your Zoom menu and open that up, and feel free to start typing your questions into the Zoom Q&A. And then I'll jump over to that in just a couple of minutes here. But before I go to that, I did want to let everyone know that this weekly meeting invite should now appear on your calendars through June 7th. We did update that to extend this meeting series through June 7th. As I mentioned last Friday, as we get closer to that date, if we feel like we still have, a volume of issues that we want to be able to be providing updates on and supporting you through, we will extend that further. But for right now, we've extended it through June 7th. You shouldn't have to do anything. It should show up on your calendar if you've already accepted the meeting invite. I also wanted to just give a quick update. I haven't mentioned it in the past couple of meetings, but we are still working on that new issue reporting form that I had been commenting on several weeks ago. We are in the final round of edits right now, so I am hopeful that that will be able to be rolled out soon. But in the meantime, as always, if you have questions about provider authorizations, please use the resource coordinator odes@maine.gov email address. And if you have questions about organization or location addresses or adding or new locations that you expect to be seeing that you're not, or if you need to add a user or terminate a user from the system, please use the evergreen.dhhs@maine.gov email address. And we'll try to get to those just as quickly as we can. There was actually another item that came up on Monday's meeting with the agency support people that I wanted to bring to this meeting. We've discussed it internally, and we've come up with hopefully a solution to the problem for all of you. So the issue that was raised was around the person records and having like many phone numbers that some of them appear to be duplicated, or maybe not even duplicated, but just unnecessary. They're just old, phone numbers, addresses, and contact records that, weren't necessary. You didn't need them in the system, and they were creating a lot of clutter. And you, as end users, don't have the ability to delete those. So I'll be sharing this with the community case managers and BI care coordinators and guardian reps on the agency support meeting on Monday as well. But we've come up with a solution to hopefully help with that, where through the end of the calendar year, we're going to direct those that do have access to edit phones, addresses, and contact records on the client person record to enter the word delete in the note field for any that they believe should be completely removed from the system. And we will, my team will create a way, like an automated way of identifying those that have that note, have that word delete in the note, and then we will periodically go in and just delete those out of the system. So again, hoping to remove some of the clutter on the person record for you. I know there's a lot of data that got migrated in from EIS, MIMS, some that already existed in Evergreen because of public guardianship representative and our deploy back in June of 2020. So really trying to help you get that cleaned up and not so cluttery and a little bit more usable. The other item that I wanted to just put on your radar, and I may have mentioned it at last Friday's meeting. Apologies if this is redundant. I definitely discussed it on Monday with the agency support people, but For those of you that are reportable event providers and you're like Section 50 ICF IID, and you somebody that isn't necessarily a system user that needs to enter a reportable event, or somebody that is unable to enter a reportable event in the system but needs to submit a reportable event. We have created a paper form for that. It is also in the final round of edits, and hopefully we'll get that posted next week to the Evergreen Help Center. And I'll also, when I send out the weekly communication next week, I'll also let people know that that paper form exists. So if there's a reason that a reportable event cannot be entered into the system electronically, there will be an alternative for that. And the information will be coming out next week on that. I also wanted to remind everybody that tonight is a deployment night. So the system will be down for a few hours, starting just around 5 p.m., a few minutes after 5 p.m., and likely until sometime between 7 and 8 p.m. So definitely be aware that the system will be offline for that. And there are a few fixes that are expected to go live with that deploy if everything goes well. That will be positive improvements for this group. There are several that will affect community case managers and care coordinators as well, but I won't cover all of those during this call since it is focused on provider users. But the ones that are expected for your group are related to the behavior management plan. The attachments from the previous BMP will no longer copy forward, so that new attachments should be uploaded when a BMP is being requested for renewal. I don't know if I'm using the right term there, but when your BMP needs to be submitted for review again, you'll be able to upload the new attachments, and the previous ones will not copy forward. Under the person summary, you should be able to see, as a reportable event provider, you should be able to see the active assignments after the deploy tonight. And then as it relates to the reportable event form, the duration of restraint time should start calculating properly. I know there had been an issue with the calculation there. And under the appointments and meetings on the person record, there was a field when in EIS, when other was selected, there was a text field to describe what other meant. And that did not migrate when we went live back in February of 2020. So there will be a data fix to migrate that missing EIS data from those appointments and meetings that migrated over. So those are the 4 items that are expected for this group, affecting this group. And then again, several others for community case managers and some for state staff users. I also wanted to just let this group know, because I know last Friday, there have been a lot of comments in the Q&A about, community case managers not being aware that they still needed to provide you copies of the person-centered plan, that they needed to notify you when service implementation plans needed to be filled out or revised, a few other things. So I wanted to let you know that at Mondays, this past Monday on the 13th, at the agency support person meeting, I did provide 4 reminders related to case management and care coordination activities. And I also included those in the weekly communication that will go out after this meeting. I apologize that the weekly communication didn't go out earlier. I was waiting on a little bit of feedback, and then I got pulled into some other higher priority items. So I wasn't able to get that out until planning on sending that out today. But those will be included in today's communication. But they are, these are the reminders that I gave them, and that will be in that communication. I reminded case managers and care coordinators that they should continue to notify service implementation plan providers that need to populate those or modify those until we're able to turn the notifications back on. And then I also reminded them to please be sure to link services, needs, strengths, barriers to the goals in the PCP before they invite you to submit your service implementation plan so that you are able to see the goals and, needs and strengths and barriers and everything showing up on your service implementation plan form. I also reminded them that they would be the users of the system that would have to submit safety device packets, and that the reason for that was that safety devices need to be documented through the person-centered planning process. And since they author the person-centered plan, they are also responsible in Evergreen to submit the safety device packets, but that you as providers would still fill out the paper device request form and get that signed by the doctor or guardian and then send it to them for submission in Evergreen. And then lastly, I also reminded them if they could please continue to submit behavior management plans in Evergreen until we're able to resolve the attachments issue that is preventing provider users from being able to attach those necessary documents and complete those forms yourself. So again, hoping that helped. We also put those reminders out on the case management Microsoft Teams channel earlier this week, and those will go out in today's weekly reminder as well. So I think that was all the general items that I wanted to cover with you this morning. I do see that I have a couple of questions here in the Q&A, so I'll jump over to those. Also, if anybody has any other questions, please pop those in the Q&A. So there is a question, are there any updates on the availability of individual authorization forms on Evergreen? We are using the PA utilization report at this time to view them, but will there soon be an option like there was in EIS? We are missing the format of the SAS authorizations that have been available through EIS. Yeah, unfortunately, there is no plan to make that sort of form-based PDF format available for you in Evergreen. That is because the way access works in Evergreen is the prior authorization is considered a form in Evergreen. It's not a separate module like the way that it was in EIS. So the way that we control access in Evergreen is based on your user role. And as an external provider user, you are only given the access level to see forms that were created by an individual in your own organization. So unfortunately, you will never be able to see the PA forms in Evergreen because those are not created by somebody in your organization. They're created by our organization or the system when they're auto created by the PCP. So unfortunately, you will never have that format. You will only ever have the PA utilization report. So we are attempting to enhance the PA utilization report to include some of the additional fields of data that you needed, like the units and the rate that are in the PCP form itself. There is a question about what permissions allow a user at a provider agency to see the reportable event in the in-progress queries. So as an external provider, you would need the reportable event role in the system. So this question came from Misty. So Misty, I'm not sure what role you have in the system, but so if you, sorry, you would have to have either the PCP data entry role or the reportable event provider role. Either of those roles would allow you, nope, I take that back again. I'm sorry. You would need the reportable event provider role in order to see the reportable events. And then if you can see reportable events, then I believe you as a provider user should also have the corresponding reportable event query. Now, there is an all completed reportable events report that is not available to all of the users yet because there were some security issues with it that we're trying to resolve. And we hope to have that rolled out to you soon if you don't have access to that already. Let me just, I was going to quickly see if I could find my access control spreadsheet and see if there's a reason why you might not be seeing the reportable event query, in progress query. Yeah, you should, as a reportable events provider, if you have that role, you should be able to see the reportable events in progress query. Okay, so you're saying, Misty, that you can see it, but we have a user reporting that she can't. Interesting. Yeah, it should not be an extra permission, Misty. So if she has the reportable event provider role, she should be able to see it. So if you haven't already, reported this into the evergreen.dhhs@maine.gov email address, please do that and let us know what user is having this challenge. And somebody from my team will reach out and we'll try to figure out what's going on. There must be something wrong with her role, or her location assignments or something. So we can definitely take a look at that. There's another question about, we have a couple of clients we cannot see at all in Evergreen. One who we have been providing services to all along, and one who is new, and his home providing agency already has submitted a SIP, but to us, he just does not exist in Evergreen. So this is likely a location assignment issue. So if it was a client that you were serving in EIS, there must have been an assignment must have been ended somewhere, either in EIS prior to migration or during the migration, or once we got into Evergreen, one of your, or maybe the location that you had access to that person under in EIS was that assignment was ended on that location or something. So somewhere your staff users don't have the location, or a location that is actively assigned to that person record. And for the new person, it may be a matter of timing. So even though you've been invited to provide a SIP and you've submitted the SIP back, if the SIP hasn't been set to plan approved and the PCP and that provider has not been added to the waiver service in the PCP as the selected provider, then the system won't auto create that assignment. So a couple of different things going on here. But for the one that was existing, I would definitely say, if you haven't already, please email evergreen.dhhs@maine.gov with the person record that your staff persons are not seeing as PCP data entry role. Please let us know what staff have that PCP data entry role that should be seeing that person and that are not seeing that person. And we can go ahead and try to figure out if there's a location assignment issue for that for you. For the one that's new, I would reach out to the case manager. I would recommend reaching out to the case manager and asking if that provider has been the selected provider that should be seeing the person record, if they've been added to the PCP waiver service as the selected provider. If not, that's why. If they have, then definitely email into evergreen.dhhs@maine.gov regarding that one as well. So whenever you send these types of specific issues to the evergreen.dhhs@maine.gov email address, please provide the person ID on the person record and the user who's experiencing the challenge at your office provide their username, which is usually their first name, not their last name. But please provide that username. And if it's related to an assignment, that should be sufficient. But if it's related to like a specific form, like you have a question about a specific service implementation plan itself, or a reportable event form or a prior authorization, please also provide the like form ID number or the PA number. That will be helpful for us in troubleshooting. There's a question about how long does it take for an authorization to migrate from Evergreen to Health Pass. I noticed recently that one of our client authorizations was showing up on the utilization report, but when I checked in the Health Pass, it was nowhere to be found and has been that way now for a couple of days. This is more particular to billing, but if something is found in Evergreen but not showing up in Health Pass, should I assume that claims sent to that authorization would be denied? Yeah, great question. So the PAs that get approved in Evergreen today will get picked up tonight in a transmission file that will go over to MIMS. So MIMS will process that. The processing pauses through the weekend. So MIMS will process that on Monday. And then on after it's processed on Monday, you should see that on Tuesday morning. So if it's entered on a Friday, it could take like up to until Tuesday for it to show up. But if it's on a weekday, so like if on Monday a prior authorization gets approved, it will get picked up on Monday night and it will get processed on Monday night and you should see it on Tuesday. Now, the one caveat to that is we may approve something in Evergreen and it gets picked up and sent over, but MIMS may not be able to process it for one reason or another. So MIMS may send an error back to Evergreen about that prior authorization. That error information will show up on the prior authorization, and we do also get an error report, a PA error report. So our resource coordination team would be notified that that errored, and then they would be seeking to try to remedy that. And the assigned case manager also is made aware when a prior authorization errors. Now, right now, that notification may be turned off for community case managers, so I don't know that they're receiving those individual notifications when those PAs are erroring right now, but we on the ODE side do get a notice when those error. So then we would follow up to try to help figure out why MIMS was not able to process that. So in this case, if it's been a few days, Nicole, I would suggest sending an email to resource coordinator odes at maine.gov with regard to the specific PA that you're seeing on the utilization report, but you're still not seeing over in Health Pass, because it should be there. So it may have errored, and we may be researching that already, or may need to follow up on that for you. But
Hey,
generally,
Leslie. Oh, sorry.
yeah,
I was just going to chime in. It's Emily. Just
yeah.
one little extra piece of information. If your parameters on the PA utilization report, I believe it's if the MIMS response is set to null, I believe. I've had some folks confused saying, there's no authorization ID number. It sounds like that's not the case here, because you were saying if it's submitted, would it not pay? So you're seeing an authorization number, but again, just human error. There can be situations where an authorization is approved but not submitted. And so again, if the MIMS response is null and as one of your parameters, I believe that's potentially a reason why you're seeing an authorization that again is approved but may not have even had that last click to be submitted. So just wanted to bring that up.
Thank you, Emily. That's helpful. Yeah, but so if you do see a MIMS response in there, like it's sent to MIMS, submitted to MIMS, but you're still not seeing it, generally it should be within 1 business day, with the exception of the weekends. The file processing doesn't happen over the weekend. So we pick up all the weekend stuff on Monday and process it. but generally it should be about 1 business day. So if it's been, multiple business days and your PA utilization report has the PA number and is showing you that it was submitted over to MIMS, then definitely reach out to us. There is a question here. We still have many auths that did not migrate well and have not been corrected. In addition, CCMs have told us that it could take a month for state reviews on PCPs. I thought help was stepping in. Are they getting caught up? I'm not sure what to expect for timelines on these processes. Emily, do you want to provide any?
Sure. Yeah, I'm just quickly rereading that myself.
Sounds like
so. In terms of auths that didn't migrate and haven't been corrected, Paul, I know we've emailed about a bunch of different cases, but if there's still lingering issues, please feel free, like Leslie said, to email resource coordinator odes@maine.gov. The state reviews on PCPs help us stepping in. Maybe what you're referencing was, we may have referenced during one of these calls that we'd worked with some data entry contractors, but it was not related to state reviews. It was really just more correcting very specific data entry issues where we could say, this end date should be 2024 and not 2025, or these units should be increased, by this specific number. It was not state review specific tasks, because that requires more knowledge and judgment than we would ever work with others on in a short period of time. So all that to say, no, I would say that it could take a month. I mean, perhaps that was the manager said at the very time point. Currently, no.
Sorry, I think you broke up a little bit there at the very last on the state review timeframe. At least for me, you did.
I'm so sorry. Yeah, I was saying that may have been the case at the beginning, but that's not accurate currently. But we've had some folks that have forgotten to hit submit. There's many different, I think, situations, case manager specific when it comes to state review, Paul. But if there's cases you're concerned about, I think I'm glad to look into. And we'll work to give averages, I think, in the future, if that's helpful to folks.
Thank you, Emily.
Leslie, can I speak to the state review topic? So we do pull queries daily for state reviews from Evergreen if they're in a state review status. We are currently up to date for the initial and annual state reviews. The change state reviews, change PCPs are a little bit more a little bit more difficult to figure out when they come in, but we are staying on top of both types of changes. So and as everybody is learning this system, our efficiencies are improving daily. So back in March, yes, we were probably a lot more behind, but we're learning every day how to be a little bit more efficient. So hopefully you'll see that progress as we move forward.
Thank you, Alexi. Yeah, definitely understand that, initially there were some delays. The state staff, all of our users are, learning the system and becoming more acquainted with it and becoming more efficient. But there were a variety of reasons for delays early on, everybody being new to the system and not really knowing how to navigate it as well as they did in EIS. So appreciate the continued patience. Definitely seeing significant improvements. So if there are specific cases or issues where you're still like, this one's still been lingering for longer than I expected it to, then please feel free to submit those emails. And we'll follow up on them for you. So I don't see any additional questions in the Q&A. Definitely want to be respectful of everyone's time this morning. So appreciate your continued participation in these meetings. Hope that they continue to be helpful for you. Please keep your eye out for the emailed weekly communication. And we will convene next week. And everybody keep your fingers crossed for a smooth deploy tonight. And hopefully those few issues that I rattled off for you will be live in there after about 8 o'clock tonight. And everybody have a great weekend. Thank you.